Cardiac arrhythmia is an abnormal rhythm of the heart. The usual symptoms are a pounding sensation in the chest. When you check the pulse, it may be rapid or it may be erratic. There may be associated symptoms such as breathlessness, dizziness, or if the heart rate is very rapid, it may cause chest pain. When we're evaluating somebody for a cardiac arrhythmia, we attempt to document the arrhythmia on some type of recording device. If they happen to present to the office while they're having symptoms, one of the best recording devices that we have is a 12-lead EKG. A 12-lead EKG documents the rhythm on a piece of paper. We can review the rhythm, and from that we can determine whether it's a benign rhythm or what chamber the arrhythmia is originating from, whether it's a benign rhythm or potentially a more serious type of rhythm. We also can determine whether the patient's had a previous heart attack from the 12-lead EKG. So that's a very useful device to use. If the symptoms are happening less often, possibly once or twice a day or maybe every other day, this device is commonly used. It's called a 24-hour or 48-hour Holter monitor. This device is attached to the patient's belt. It has skin electrodes that are placed. It records the heart rhythm continuously for 24 to 48 hours. This is fully downloadable onto a computer. It has an associated diary that the patient fills out. When the patient writes down the time that their symptoms are occurring, also what symptoms that they're experiencing, we can go back and look at this monitor and see exactly what their heart was doing during that episode. If the episodes are less frequent, if they're occurring once a week or possibly once every 2 weeks or maybe even once a month, this recorder is commonly used. It's called an event recorder. This is something that the patient can carry in their pocket or in their purse. If they start experiencing symptoms, the device is placed on the chest, a number is dialed, phone number is dialed, and a button is pressed and the device is activated. This can record the heart rhythm very nicely. If their symptoms are even less often, particularly if they have very serious symptoms such as unexplained blackout spells where you're concerned it could be a heart rhythm abnormality that's causing their symptoms, this is an invasive monitor that's placed. This monitor is actually placed beneath the skin of the left upper chest. The battery lasts a year. With this device, we can interrogate it through a computer, and if the patient experiences any episodes whatever, the device can be interrogated. We can document what their heart was doing during that particular episode. Once we have documented the type of arrhythmia that they've been experiencing, we can then tailor the medication for the type of arrhythmia that they're having. It may be a benign rhythm. In those situations, it may just be reassurance to the patient that everything's fine. If it's a more serious type of rhythm abnormality, sometimes we do an invasive procedure called an electrophysiology study. This procedure involves catheters advanced through the vessels in the legs. The catheters are placed in the chambers of the heart, and the electrical system is actually mapped. Once we've mapped the electrical system, frequently we're able to identify where the abnormal circuit's located. Another type of catheter is advanced up into the heart, and a burn is placed into the electrical system through the catheter. It's a pinprick sized burn. Frequently this will prevent the rhythm from ever recurring again. In the most serious types of rhythm abnormalities, the life-threatening rhythm abnormalities, those are treated with implantable cardiac defibrillators. This device is placed in the left upper chest between the skin and the muscle layer. It's connected to leads that have been placed inside the heart. This device has full pacemaker capability. It also has full shocking capability. It's monitoring the heart 24 hours a day, and if the patient should experience a life-threatening rhythm abnormality, it can charge itself within 20 seconds and deliver a shock to the patient to get them back into a normal rhythm.